Post-traumatic stress disorder, also known as PTSD, is actually quite common. It occurs in up to 8 to 12% of the population over the course of their lifetime. PTSD affects those who have been significantly traumatized by a life-threatening experience. It affects both civilians and veterans. It is a very important mental health disorder, both because it affects quality of life, but also because it is one of the leading causes of suicide. PTSD dates back in its symptomatology to the earliest recorded history with the ancient Greeks and Romans, where people were changed forever after a serious battle. It began to be seen and understood better after the Civil War and the World Wars, but was first really codified in our modern terminology after the Vietnam War, where people would come back forever changed mentally and physically. Following the Vietnam War in the 1970s, we really began to understand more about the effects of trauma on civilians with the women's rights movement, where we really began to understand the role of sexual trauma in women. Together, this led to an expanded understanding of both the similarities and differences in the role of trauma and PTSD in both veterans and civilians. There are two general approaches to treating PTSD: talk therapy and medications. Our first line of treatment is generally psychoeducation and skills training to help the patient better deal with the emotional symptoms that come with the trauma reminders and the symptoms of PTSD. However, the best empirically informed treatment we have for post-traumatic stress is trauma-informed exposure therapy, in which the patient works with the therapist to rework through the trauma over and over again until it is essentially just a boring memory as opposed to a life-threatening black hole of emotional symptoms. I'm particularly excited about future treatments for PTSD. In fact, in PTSD, we understand the most among mental health disorders about the neuroscience, biology, and genetics of post-traumatic stress. At Mass General Brigham, we have numerous studies ongoing to really expand the treatment of post-traumatic stress, whether it be using neurotherapeutics such as transcranial magnetic stimulation, targeting specific brain networks to alter how they work and to improve their functioning in post-traumatic stress. We also have novel drug treatments that are really targeting the underlying biology of post-traumatic stress disorder. One of the most exciting future opportunities is preventing PTSD from ever happening. At Mass General Brigham, we have large studies identifying people in emergency departments after trauma and understanding the biology, psychology, and brain mechanisms of the development of stress, trauma, and PTSD over the weeks and months after trauma. These sorts of studies make it possible that we might be able to have interventions in the emergency department or the first night of sleep, just like we do for heart attacks or strokes, to prevent the trauma from ever developing into PTSD in the first place. Thanks for watching. I'm Dr. Kerry Ressler. For more videos on mental health, click here. And don't forget to subscribe by clicking here.